Good afternoon, everyone. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy. Good afternoon, everyone. We're reporting 67 new cases of COVID today, but as Dr. Strang is about to tell you, that isn't the full picture. We have a backlog of tests in the lab, and a number of those cases are likely positive. The people who tested with symptoms are isolating and waiting for the results. Please continue to do that. Our labs will work over the weekend to deal with the backlog and get the results out to people right away. The backlog is a result of a surge of cases a week ago before we put restrictions in place. This is why it is so important to follow the protocols and support this latest shutdown. We have 22 people in the hospital and 5 patients in the ICU. That means we have 589 known cases of COVID in the province. That's nearly 600 Nova Scotians that are battling this disease, and we know the numbers will continue to climb. I want those people and their families to know that Nova Scotians stand with them, and we're all hoping for a full recovery. I want to thank our team working in the labs to process our cases. I'm grateful for your hard work and helping keep us safe. Dr. Strang, I'll turn it over to you for the more thorough breakdown.
Thank you, Premier. Good afternoon, everybody. We do have a vaccine program update today, and it is good news. Things are going well, and we are on track. But unfortunately, I do have some bad news first. As the Premier said, we have backlogs in our lab and with data entry in our public health investigations. The data entry backlog means today's case numbers are actually, in all likelihood, much higher than the reportable number of 67. There's also a large backlog in our lab. About 45,000 tests have yet to be processed, and things are about 3 days behind. This is not a reflection on how hard people are working. They are working around the clock. But Nova Scotians have all done what we've asked you to do and more, and we're dealing with a very large volume of tests. We know there will be positive cases in this backlog, and we need to be prepared for substantially higher case numbers over the next few days. The lab and public health are working now to clear the backlogs. We're also making short-term changes in our testing program so that our testing volume matches what the lab and public health can do. Starting immediately and for the next few days, testing appointments at primary assessment centers can only be booked if you have symptoms, if you have been told by public health that you are a close contact of a case, if you've been at an exposure site where public health announces a public exposure, or you have traveled for any reason outside of Nova Scotia, Newfoundland, or PEI, and you're required to be tested. If you're in one of these groups and you have an appointment, then you are asking that you cancel your booking appointment or just do not attend. Anyone in one of the groups who is not in one of the groups just mentioned who wants to have a test will still be able to get a rapid test at a pop-up site. And if you have a pop-up site close to you, that's great. We're building capacity in other parts of the province, but if we won't have it immediately available. And if you don't have one close to you, we're working on that, and we'll get one in a community close to you soon. We're asking for everybody's patience in this situation. It's critically important that the capacity we have for our primary assessment centers is reserved for the people who need to have the more accurate PCR testing, and people who don't need those tests, you need to go through one of the alternatives through a pop-up site. We are in a serious outbreak situation. We are seeing the stresses on many parts of our healthcare system, such as public health, the lab, and we're beginning to see impacts on our hospitals. We have seen a substantial increase in hospitalizations in the past few days, and I expect that this concerning trend will continue. There's always a time lag between cases and then a portion who develop severe symptoms and require hospitalizations. As a result, You will see some service reductions in the coming days to free up beds and resources within our healthcare facilities to deal with this expected increase. And we need all Nova Scotians to do their part. If you want or need a test for COVID but can't get one right away, stay home until you can. If you're waiting on a test result, stay home until you get one. If you know you're a close contact or have been in one of the places of public exposure and you haven't heard from public health, stay home and isolate until you do. I know this is a lot to hear, but this is a very serious situation, and we all need to act accordingly. Do not panic. Be patient. Stay calm and stay home.
So today we're going to do something just a little different. Before we take your questions, Dr. Strang and I thought it would be helpful to share some details about our cases in our province and some more details about our vaccine rollout plan. So I'm going to turn it back over to Dr. Strang.
We should have the slide coming up. So if you look on the slide screen behind me, this shows the number of cases, and there's third wave by age group. And if you look at if you remember the epidemiology we had in wave 1, we saw that the majority of the cases were older Nova Scotians, and this was true across Canada. The majority of our cases this time are in the under 30 population, and then we're also seeing in the 30 to 50-year-olds an almost equivalent number. So certainly the age groups have shifted downwards, and again, this is the same as we're seeing across the country. And while the younger age groups are at less risk of severe illness, we are seeing severe outcomes in these age groups across the country. We cannot be complacent simply because of the shift in the age.
So obviously we're in a serious scenario in our third wave. This variant is taking hold, certainly of our Halifax area. We're all working very hard to have the restrictions in place, and I know most Nova Scotians are following it. This variant does not discriminate. It's reaching every community, every age cohort. So it's super important that we follow those protocols. We stick to the basics of wearing your mask, continuing to keep your distance, washing your hands, and following these protocols. I know they're strict, and in some cases stricter than previous waves. There are some businesses that had to shut down, and I get your letters and I get your situation. It's disrupting daily lives, but we want to make sure that you know how serious this is. We're working hard with our vaccine rollout, dropping our age groups as fast as possible. Now AstraZeneca going out to thousands of people in their 40s. That's why we continue to stay on track and not veer off our vaccination plan. And I'm going to turn it back over to Dr. Strang to give a status update of where we are with our vaccines.
So this is the coverage rate by age group. And so what we see is we've had great vaccine uptake so far. Older Nova Scotians are leading the way, and we need, as we move down to younger age groups, we need them to follow that as well. We are well over 80% of people for those who've received at least one dose of vaccine. For those is age 80, 75, and 70. And the 65 to 69-year-old age group is quickly catching up, and they're just below 80%. So Nova Scotians are doing their part and getting vaccinated. And as I said, as we quickly move into younger age groups, it's critically important that we get the same type of vaccine uptake in those age groups as well. The other big milestone we passed this week is 300,000 doses in arms. As of yesterday, 33% of Nova Scotians eligible to get the vaccine have had at least one dose. And as I said, as we open up to younger age groups, we need to maintain this high coverage rate to build the strongest level of protection against COVID across our population.
So when I look at that graph, I see that many of our grandparents have got their shot, which is a good thing. Happy about that. A number of our parents have gotten their shot. We're doing well with nearly all of our long-term care center residents getting their first and second shot. Our rollout plan is on track and in some cases ahead of schedule. So I have confidence that we have the right system, and if our supply continues to be secured from the federal government, we will have that opportunity for everyone to have their shot. So we're talking 6 to 8 weeks for all Nova Scotians to have an opportunity to get their shot. So please book your vaccine. It's a good thing for to see Nova Scotians more and more asking when they're going to get their shot. So we're seeing that high percentage of take-up. So that's very positive. And as we continue to wait for your shot, I appreciate your patience as we work through the age groups, continue to support one another and continue to stay home. And Dr. Strang is going to give more on the age group approach.
So this last slide shows that we are on track for all Nova Scotians who are eligible for vaccine to be able to start to book their vaccine appointment by the middle of June. Our age-based approach is working, and the finish line for the first dose is in sight, and we're actually slightly ahead of schedule. We are, as the Premier said, we are about 6 weeks away from everyone being able to book an appointment to get their first dose. 40-year-olds will be able to book in just a few weeks, 20-year-olds by the beginning of June. I know that our current situation has people scared, and everyone wants a vaccine. Many groups want to be prioritized. We made a decision early on that the race to population immunity was a priority and that focusing on age was the fastest, most efficient way to do that. We built an equitable, reliable, flexible vaccine program while waiting for our supply to increase from the federal government. We got good, and now we are getting fast. We are now outpacing others as the fastest vaccinating province in the country. But we have to stay with the age-based approach for all Nova Scotians. We are at a critical point in the race between variant and vaccine, and we cannot deviate from our effective age-based process.
So our plan is working clearly. You're seeing age groups up there that will be able to get their shot in June. Younger ages that are coming online for approval through Health Canada that will be able to deliver the vaccine, contingent on the supply from the federal government. Because of our reliable system, we did not have to cancel thousands of appointments like you have seen in other provinces. We're remaining on track as long as we stay disciplined. And I do appreciate that a lot of people want to get their shot, and we'll continue to make sure that we're getting our supplies out to the pharmacies and doctors' offices, and thank you to those working in our clinics that continue to work hard in these clinics and in pharmacies across the whole province, and all the support and positive comments about how our central booking system is working. That's been a strategy that's worked well, that nationally has been recognized as a good system, and our approach to work alongside also our African Nova Scotian communities, our Mi'kmaq communities. The leaders of these communities have stepped up, working with elders and others to continue to ensure that we remain on track. So thanks for the cooperation to all Nova Scotians. We'll continue to get through this together, along with our vaccine program, our testing strategy, and these now more strict restrictions are absolutely the way that we need to approach things.
And in closing, I need to say I'm not trying to scare people, but I need to be blunt. This situation is very serious, the most serious we've been in throughout the entire pandemic. The closure of restaurants, bars, gyms, and many other places where people gather is necessary. All of us following restrictions and going beyond those restrictions even is absolutely necessary. Our vaccine rollout is going according to plan, and we're close. We're getting closer every day to the minimum level to build population immunity. But we cannot vaccinate our way out of this immediate problem. The only quick and effective solution is public health restrictions and border measures that we put in place. We are asking a lot of Nova Scotians, and now we're asking for a little bit more. We need your help and your patience as we address the testing backlog. Nova Scotians, if ever there was a time to stand together, this is it. Stay home if you can. Employers, you need to let your employees work from home wherever possible. The risk is very real. We're hearing in public health, we're hearing clusters and outbreaks in workplaces where employees could work from home, but employees are still being required to be at home. So we need employers, wherever possible, allow your employees to work from home for the next short period of time. Everyone needs to follow the restrictions we put in place and make safe choices to limit your contacts and movements. It's critical that we do everything we can now to protect each other, protect our healthcare system, and have our vaccine program roll out in the days and weeks ahead. As I said yesterday, our collective actions will determine the path we're on. We've put everything in place, restrictions, border measures, and a solid vaccine program, that if we follow those and do everything we each can do as individuals, they will allow us to get things back under control and enjoy spring and summer safely and with less restrictions. It is up to each of us now.
Thank you, Dr. Strang, and to you and your team. I've certainly seen it firsthand over the last few months how strong the team is working nonstop and now that we're in this third wave, it's very serious, and these Nova Scotians have been working over the last year, and of course our healthcare workers and volunteers working on the front line. I can't say enough about what I'm seeing across the province. So now I think we're ready to take our questions.
We'll take one question and one follow-up in the time that we have for today, beginning with Natasha Pace with CTV.
Thank you. Dr. Strang, which variant are we seeing most of in Nova Scotia right now?
It's predominantly the B117, what people have referred to as the UK variant, but we're also seeing the other variants in a much a smaller amount. We're working on the assumption that every case we have is in all likelihood a variant strain, and we know that the variants have just this ability to act faster, and that's why we have to be very firmer and act quickly to stay out in front of them.
Go ahead with your follow-up, Natasha.
Thank you. Could you give us an update on how the bookings for AstraZeneca have gone today? Obviously, today was the first day that people between 40 and 54 could book a shot, and it appears as though most, if not all, of those appointments are filled. Is that correct?
That's my understanding. You probably know as much as I do in looking at the exact appointments, but I did know from my team quickly that thousands of the appointments had gone within the first few hours.
Next, we'll go to Keith Doucette with the Canadian Press.
Yes, Dr. Strang, I guess it's a bit of alarming news that the case counts may not be totally accurate at this point. How long have you known about this problem? And again, could you give us more information as to exactly why this is happening?
So we learned late yesterday about the backlog at the lab, and then we learned today about the data entry issue. So we're being very open with Nova Scotians. It's simply a fact that we've had thousands and thousands of test results come in. We've greatly increased our capacity in our lab. We've significantly increased capacity in public health. Every single person in public health and other parts of the health system is being deployed to support the work of public health. We've got, I think, over 70 people from my department who have put their hands up and said, we're going to volunteer, and they're being deployed in to help public health. Despite all that, we are being overwhelmed by the number of cases and the number of tests that we have. It's just simply a reality. We have finite capacity, and we're overwhelming that capacity. And people need to understand that. This is nobody's fault. Everybody's working extremely hard. It's just a reality, and we have to get this under control, and we're relying on every Nova Scotian who has to do what we're asking them to do to get this under control.
Go ahead.
Keep in mind, so we had 3 days in a row of record cases, day after day. So we've asked Nova Scotians to come out and get tested. They have in record numbers. Obviously, all those cases had contacts that we had to trace. So the team is working incredibly hard. That's a result of what we're asking Nova Scotians to do, and we'll catch up. And Dr. Strang and I and the team both thought it was incumbent on us to make sure that we're keeping Nova Scotians informed every step of the way.
Go ahead with your follow-up, Keith.
Yeah, and as a follow-up to that, Dr. Strang, so aside from asking people to adhere to the guidelines you've laid out for testing, is there anything that you can do within the system to alleviate some of those pressures?
So they're actively working at the lab to resolve the backlog, and in public health, we're looking at some measures about both those backlogs should be resolved in a couple of days. We're adjusting our testing, so the message to Nova Scotians about those who need to get a PCR test and have to go to an assessment center, they need to do that. For those who don't, those who have no symptoms, it's critically important that you don't clog up our system. So if you go online, don't pretend you have symptoms if you don't have symptoms. Find a test, a rapid test through a pop-up center. That means you're going to have to be patient for a bit of time. We need Nova Scotians' cooperation as we recalibrate our testing system just for the short term to deal with this.
Next, we'll go to Shayna Luck with CBC.
Dr. Strang, when you say substantially higher case numbers, how many cases do you believe could exist among the backlogged test? What's your best guess for our true positivity rate?
So I'm not going to make a guess. If I knew that number, we wouldn't have a backlog. We'll wait and see as we clear the backlog what it actually shows.
Go ahead with your follow-up, Shayna.
Are we maxed out at the lab, or with specific resources, could we get the lab processing faster? I mean, do we need another lab? Are we talking about people or equipment? And where could we get those kinds of things?
So we are in the short term, we are maxed out our capacity. You don't just stand up another lab. Some of this is human resources, and some of it is people are highly trained and skilled people that you don't just pull off the street. But you have to remember that we have gone from February 2020, we could do 200 tests a day. Today, we can do 15,000 tests a day running through the lab. So we have worked miracles building lab capacity, more than any other province, but it is finite, and we've hit that limit.
Next, we'll move on to Jesse Thomas with Global.
Thank you very much. I just wanted to follow up with Shayna's question. I guess, we're seeing these numbers, I hate to say trending downwards, but here we with 45,000 cases in a backlog. The numbers we're seeing come out almost paints a rosier picture. I'm just wondering how dangerous it is not to, understand how bad it really is out there. If we have this backlog, Dr. Strang, how bad? I mean, what's the world look like now?
We know we have widespread of COVID and the variants in the Halifax area. I don't believe at all, as we clear the backlog, it's not going to change our overall epidemiologic picture. Almost all of these cases and the backlog is coming from Central Zone. So we have widespread within HRM. We put measures in place to bring that down, and we put measures in place across the province, so if it does get spread, it doesn't, if you will, there's no fuel on the fire to create another big outbreak somewhere else in the province. We need to allow those measures to take place. They've only been in place for a week. It takes a week to 2 weeks to really start to see the impact of those measures. I'm fully confident that we will, but as we get into next week, we will start to see things trend downward. What we're seeing in the backlog of cases and the things you'll get through and the high numbers that we'll see in the next few days, they're a result of things that happened in people's actions a week to 2 weeks ago, which was before we put the restrictions in place. We were fully prepared to have a surge of cases. It's just, we have more than we actually anticipated. But it doesn't mean that this cannot be controlled. It adds, what it points out to is that we made the right decisions on tightening down as far as we could go province-wide very early on. And that will protect us. That will allow us to get out of this, and our vaccine program builds the longer-term protection as we get into June and the summer.
Go ahead with your follow-up, Jesse.
I guess just looking at the hospitalizations numbers and the amount of people that are in the ICU, I don't think we've had this many people hospitalized since the pandemic was declared. Given the backlog in cases and the amount of cases we have now, what's it going to look like in the next week or two at hospitals? How are we prepared to see potentially an influx, maybe double these cases?
So we fully expect we're going to see more hospitalizations and more ICU admissions in the week to 2 weeks ahead. There's always a time lag. So even as we get things under control, it will still put pressure on our hospitals. But my colleagues across the healthcare system are working diligently to build that capacity by shifting resources, by closing other parts of our health system down. Less necessary and essential services across the health system are being ramped down to build the necessary capacity to deal with what we expect we would see in terms of hospitalizations and ICU admissions in the days ahead. But that's another reason. If people are concerned about that, this is a critical situation. As I said in my remarks, this is the most serious place we've been in this pandemic. We're doing everything we can to manage it, and I believe we will. But we need every single Nova Scotian to step up and do exactly what they need to do.
Next question will go to Kathleen Jones with All Nova Scotia.
Thank you. Dr. Strang, we're hearing at the moment that people are having their own surgeries canceled last minute because pre-op COVID test results haven't come in, and that this is happening on the daily. I'm wondering if you can give an idea of how many people have been affected by this.
I don't have a scope on that. It's unfortunate, but again, that's the reality of the type of situation we're in and the serious nature of it. I fully appreciate how problematic that can be for people to have their surgeries canceled last minute. But it's an indication of the stress that our healthcare system is under and the need for all of us to pay close attention to that.
Go ahead with your follow-up, Kathleen.
Premier Rankin, I'm wondering what the status of the group in charge of the Business Impact Grant at Dalhousie is and when that program will be up and running.
So I hope to have news on that on Monday. I've been pushing very hard, making calls myself to the groups, the third-party groups that are involved in administering some of the grants, both the Small Business Impact Grant that I committed to and the previous grant that was committed to for property tax rebate. I know that there is eagerness to get that funds out to businesses. I understand that rent is due for many of them tomorrow, and all I can say is that we're pushing very hard to ensure that that program gets expedited and we get support out to our businesses.
Next question will go to Nabal Snom with the Herald.
Good afternoon. Dr. Strang, as we said that there are more hospitalizations now due to COVID. I was wondering what the capacity of hospitals in HRM is, and when do we know that we won't have any more space?
So we're aware we've got some modeling projections that would suggest the number of hospitalizations and ICU admissions we can expect over the next week to 2 weeks. We're actively working to manage that within the healthcare system by, as I said earlier to the previous question, by stopping some procedures, stopping some outpatient clinics, redeploying staff in, so we make sure we have the capacity that we anticipate that we're gonna need. It's important people understand that what I see is a health system that is working tremendously hard, that is working in an amazingly collaborative way. We're looking at everything as a single system, and every part of that system is working in a very coordinated way to pay attention to what we need to put in place to deal with the potential needs for acute care capacity. And it's quite amazing to see actually how the system is working as it's meant to, as a single system.
Go ahead with your follow-up, Nabal.
I was also wondering, with vaccine appointments fully booked in HRM, you said earlier this week that people can go to the next city or to the next town and book an appointment there if they needed to. That would be okay. Is that still your stance on this, or has that changed?
No, we said what we're looking at is for people to avoid non-essential travel outside of their community. If you need to travel for work, for education, for legal, child custody reasons, for necessary and essential health care, you can do that. Certainly getting a COVID test or getting a COVID vaccine is necessary and essential. If you need to travel, try to do it as close to home as possible, but absolutely, you need people to be able to get those important appointments.
Next question will go to Adrian Blanc with Radio Canada.
Thank you. You talked about service reductions in healthcare. I wanted to know more about it. If you could give a few details on what services would be closed, for example.
So I'm not involved in that level of planning. There's teams of people in the acute care system working out all those details. But what I do know is that they're actively working to make the reductions and reallocate resources based on what we anticipate we'll need for bed and staffing capacity to deal with people ill with COVID.
Go ahead with your follow-up, Adrian.
Regarding the modeling you showed earlier, why aren't you able to tell people precisely when each group will be able to book a vaccine like Quebec did yesterday, for example?
Well, I think if you look at that third graph, it's pretty precise. You can see each age group within a week when they're going to be able to be start to be opened up for their vaccine. We can't tell you a specific day, but given a week is pretty precise. Some of this depends on, it's all dependent on exactly getting the vaccine that we expect we're going to get. And we've been able to, throughout this, we've been able to actually add new age groups slightly ahead of when we're targeted on. So I think we're fairly precise, and if that trend continues, we'll be able to actually give people some good news and open up a little bit earlier.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi. Dr. Strang, in the past you said there wasn't enough data to answer this question, but I've been seeing a lot of things published in the very recent days about the number of people who have been vaccinated and what their potential to further spread the disease. Are you conversant with that new information? And if so, how does that apply to Nova Scotia?
We have a lot of conversations at the national level about how that emerging evidence. I don't deal with any one single study. I look at, there are people at a national level who are pulling that collective evidence together, and it's presented to us at the Special Advisory Committee table that I sit at. We're actively discussing at that table and provincially about how we, over time, may modify our public health measures and public health restrictions and differentiate between people who are vaccinated versus unvaccinated. But the clear consensus of public health is that before we do any of that, a lot of it depends on having a highly vaccinated population, because the literature will say that the risk is not zero, that there is still some risk of people who are vaccinated being able to transmit asymptomatically, low, but some risk. What makes it feasible to modify restrictions if everybody else around those individuals is also vaccinated? So we will get there, but we're not at this point in time. We're in the middle of a serious outbreak.
Go ahead with your follow-up, Tim.
Yeah, do you have any better sense? Is there community spread in the Cape Breton area? I know that you had feared that. Is the testing backlog making it impossible to say one way or the other?
No, we're paying very close attention. Fortunately, we have testing capacity directly at Cape Breton Regional Hospital, so they're not dealing with the same backlog issues that we are down at the lab here in Halifax, which basically deals with the tests, the swabs from all the rest of the province. What we're seeing in Cape Breton is still reassuring that we have numbers of people there that is slowly going up, but still single-digit numbers, and we're not seeing any signs of community spread there, and we are able to stay on top of that with our testing in that part of the province. So we're watching it carefully, but everything is looking relatively positive and stable.
Next question will go to Pat Healy with the Laker.
Hi, this question's for Dr. Strang. You mentioned yesterday and again today that you're not seeing community spread outside the Halifax area, the Central Zone. Why are we not seeing those signs of community spread outside the Halifax area? What are we in East Hants, Truro, and the Amherst area doing differently?
So I don't think it's doing anything differently. We've been fortunate so far. We know throughout this whole pandemic where you start to where COVID takes hold in a jurisdiction is in the large urban areas where you have much greater density of people, and that is what drives the transmission. Everything we're doing now is to stop it from spreading further out, and that's why everybody in the communities you represent, Pat, in your coverage and across the province need to be very diligent about what each of us are doing, keeping our own community safe.
Go ahead with your follow-up, Pat.
This is for Dr. Strang and Premier Rankin. The tone of today's briefing is very serious. What do you want Nova Scotians to take away from today's briefing?
So I'll be sure, take it seriously.
And I'll be short as well. Stay home.
Next question will go to Daryl Cole with the Amherst News.
My question is for Dr. Strang. A week ago, I interviewed the Associate Deputy Minister in charge of the vaccine rollout for the province, and I asked her why people of Cumberland County were being required to travel an hour to Truro to get the AstraZeneca vaccine. And the reply I got was because of the age profile of the vaccine for ages 55 to 64. And now the vaccine has been extended to those age 40 and above. There are still no clinic scheduled in Cumberland County. People still have to go to Truro. Why is that?
So, I'm not involved in the details of the planning. We've had lots of access to AstraZeneca vaccine in Amherst over the last number of weeks. We have a limited amount of additional AstraZeneca vaccine, about 10,000 appointments that needs to be spread across the province. So, we're trying to spread that out as equitably as possible. But the narrative that some people are pushing that there hasn't been access to AstraZeneca in Amherst and Cumberland County is actually wrong.
Go ahead with your follow-up, Daryl.
As part of the restrictions that were put in place to limit the control and the spread of the virus, both yourself and the Premier have asked Nova Scotians to stay in their home communities. But is it okay for someone to travel an hour from Amherst to Truro to get vaccinated?
So I think I've answered that question already today. Vaccination testing is an essential health service, and you should get that as close to home as possible. But absolutely, if you need to travel, you can travel.
Next question will go to Chelsea Gould with Saltwire.
Thank you. Premier, many childcare workers are parents themselves and are now struggling to juggle that work while helping their own kids with at-home learning. Are there any supports available for these essential workers to ensure that their own kids don't fall behind in school?
So we recognize that there's challenges presented to families that are at home with their kids, and we continue to do our best to make sure that they're supported with the tools that they have from each school. We've had those online booking tools that were in place, ready to go as soon as we canceled schools, and I'm hearing a lot of positive feedback, and credit goes to the teachers really that have been able to adapt quickly to be able to support those parents and kids with their studies at home.
Go ahead with your follow-up, Chelsea.
Thank you. And Dr. Strang, some young people are now looking for opportunities over the summertime. Would you encourage them to volunteer with public health COVID efforts, even with the risk of the variant? And would their perspectives as young people be considered an asset?
So I think the biggest space that we have an opportunity for people to volunteer in right now is in the pop-ups, and we're supporting Dr. Barrett and her team by bringing in some, as I said the briefing the other day, we're bringing in some volunteer coordinators. Many of the other jobs that are required, whether it's the lab, testing, public, contact tracing and public health, those are skilled jobs, and you can't just have a volunteer. But certainly the pop-up and supporting those pop-up testing, there's a huge need for volunteers in that space, and so we would encourage people, and many young people have stepped up, and I thank them for that. It's become somewhat of a movement, to use Dr. Barrett's words, about this pop-up testing, and as we have to focus our the other types of testing on people who require the PCR testing, we need to build capacity, and we are investing in that in the pop-ups. So there is going to be a need for more volunteers to sustain and grow that asymptomatic pop-up testing over time.
Next question will go to Jake Boudreau with The Reporter.
question is for Dr. Strang. Under this new strategy you guys are unveiling today, are you guys looking at putting another site in Richmond County or Port Hawkesbury? The reason why I ask is there's currently no appointments available anywhere in the Eastern Zone. The mobile testing unit that is in Port Hawkesbury today was fully booked in about 24 hours, and the current site at Straight Richmond Hospital is not adequate to meet the surging demand.
So we're in terms of PACs, we have PACs in a number of communities throughout Cape Breton and the Guysborough Strait area. We do not have capacity to add additional communities. We're asking people are going to have a little bit of patience. But what I will say to people in areas that they're going to have to wait for a little bit, especially as we build capacity for the asymptomatic pop-ups, those are the areas where we're not seeing COVID, and the areas that people are at low risk at this point in time. So people can be comfortable by following the measures, stay home as much as possible, keep all the public health measures, and with a little bit of patience, we will get an opportunity to get tested if and when you need it.
Go ahead with your follow-up, Jake.
My next question is about on Tuesday there was a press release issued warning the public about a positive test connected to Sarek. Then on Wednesday, media reported there was new cases in Richmond County. The only information from Nova Scotia Health is that there are 4 new cases in the Inverness Victoria Richmond Community Health Board, nothing specific to Richmond County. Don't the people of Richmond County deserve to know, like the school community in Port Hawkesbury, if there have been cases so they can get tested and isolate if they need to?
So we will communicate to the public across the province when necessary about when there's a possible community exposure. Our process is always, when there's a case, if we can communicate directly to all those contacts without doing a broad public notification, we will do that. But if there is a need to do a broader public notification because we can't reach every contact directly, then we will do that public notification. But just because there hasn't been a public notification around a case doesn't mean there's not reach out and that we're not contacting contacts directly.
I just want to add to that. The message is always the same, that we need to pretend like COVID's in your community. It's across the province, we know that. So if you go out and get tested if you can. We're going above and beyond what any other province is doing for asymptomatic testing. We'll continue to do that as we can, as capacity allows, but stay home. You should be worried that COVID's in your community, and you should stick within your own family and stay home.
And that's all the time that we have for questions today. Go ahead, Premier.
Thank you. And just to add to that, I'm glad it's raining today, so people are hopefully staying at home. I wouldn't mind if it continues to rain throughout this weekend, so people stick close to home. It's hard on all of you, I know that, but it will work. I hope today's briefing about the vaccine rollout was helpful. I know many are anxious for their shot, but we're getting there. We can win this race against the variants if we stay positive and patient, and if we work together, we will prevail. Have a good weekend and take care of one another.